Thank you for visiting this video segment for Dr. AFib. I'm Dr. Morales. In today's video segment, we're going to be talking about paroxysmal atrial fibrillation. And what does that mean? And what is the significance of paroxysmal atrial fibrillation? This is a question that I get from a lot of patients. It's a common thing that people search for on the internet to understand what does it mean? What does paroxysmal atrial fibrillation mean? So first, to define it, paroxysmal atrial fibrillation basically means atrial fibrillation that comes and goes, and that you are not in atrial fibrillation all the time. And to be technical, those episodes of atrial fibrillation last less than 48 hours. And so, again, you're in normal rhythm most of the time. Your episodes of atrial fibrillation come and go and typically last less than 48 hours. And they may stop on their own, or they may stop with medications in order to classify it as paroxysmal atrial fibrillation. So that's why you may see this on some of your paperwork from either your clinic or from a hospital visit when they list your diagnosis, and it may say paroxysmal atrial fibrillation, and that was what that means, episodes of AFib that come and go. But what does that mean? What is the significance of paroxysmal atrial fibrillation? Paroxysmal atrial fibrillation is a type of stage of atrial fibrillation, and this is something that I've discussed many times on my videos in the past about how atrial fibrillation is a disease that progresses. It starts at paroxysmal, and then it progresses to persistent, and then to permanent atrial fibrillation. So in paroxysmal, when the episodes come and go, you're in earlier stages of atrial fibrillation. Basically, to think of it that the atrial fibrillation has not damaged or affected your heart too much at that point in time. When atrial fibrillation then progresses, people then start getting persistent atrial fibrillation, which is when it comes and it stays and the AFib doesn't want to go away, and you have to actually intervene on it with something like a cardioversion or a procedure to help get rid of or get you patient out of atrial fibrillation. So paroxysmal atrial fibrillation is one of the earlier stages of atrial fibrillation. And one of the significance about that is that in the earlier stages of atrial fibrillation is when a patient has the best treatment options available to them. They have better responses from either medications or even procedures called ablations. And so the earlier stages of paroxysmal, which is one of the earliest stages of AFib, you have the best treatment options as well as the highest success rates. And so this is part of the reason why I've always emphasized people to get early intervention or early assessment with an electrophysiologist, because that's when you're going to have your best chances at a higher success rate when it comes to managing atrial fibrillation. So that's what paroxysmal atrial fibrillation is, episodes that come and go, but the significance is that it's one of the earlier stages of AFib. So if you have paroxysmal atrial fibrillation, please discuss with your doctor, or please see if you can see an electrophysiologist if you haven't seen one yet, because that's when you're going to have the best treatment options versus more advanced stages of atrial fibrillation. Thank you for visiting this video segment for Dr. AFib. I'll see you next time.